It's really important to be clear what the evidence tells us we need to have in place for people experiencing homelessness. I work in South Yorkshire. There are large numbers of people who might be experiencing rough sleeping or who may be sofa surfing, and healthcare professionals will often be working alongside those residents, and it's vital that they know that the services that are put in place are the ones that the evidence tells us are most effective.
We know that people who are experiencing homelessness will die 30 years sooner than the general population, and that can't be okay. So how do we come together to work with people in their context to try and prevent that escalation of poorer health and also the harms associated with that?
Well, I missed appointments because I was living a chaotic lifestyle at the time. You know, I was homeless and I was using drugs, and I missed appointments, and so they struck me off, basically. You know, and even when I went back and I said, listen, you know what's going on. You know, isn't there any way that you can sort of like, you know, you can see me? Because I knew that I needed help.
Just having a guideline for homelessness matters hugely for how we can start to bring a collaborative approach to homelessness. I think homelessness can't be dealt with through a single agency lens or a single professional lens. It is one that takes all of us. And the guidelines give us an opportunity to talk about the expanse of homelessness, not just in terms of how we look after the people experiencing homelessness, but how we can get in earlier, understand those root causes, and to try and prevent things escalating to homelessness in the first place.
Right, you need a letter. Right. I never had nowhere to sort of like keep a letter. I didn't have a filing cabinet, so there's no way that I was going to do that. You know, it just wasn't practical. It weren't going to happen. And then with the sort of like, you know, the doctors and that, you would have thought, you know, they could have just sent something direct. They must have the addresses of these people, or even pick up a phone and talk to somebody. But it didn't happen. It's almost like everybody's just so precious about their little part, what they do. You know, they're not interested in the other side.
I think often we find when we're developing services with communities that there's a sense that we're all doing that ourselves in a bespoke way. What this national evidence provides is a sense of all the many people who've worked in this space before and what we know is most effective. So it gives us a really strong starting point for designing and developing services together with partners, often folk in the voluntary sector or in local government, not just the NHS.
The benefits, you know, for the healthcare workers will be that if they follow those guidelines, you know, I would say that I'm 95% certain that their life would be better. You know, they wouldn't, you know, be on the end of an angry homelessness person. You know, if they just take that time to follow, you know, what's been said, listen to the person, you know, treat them with respect, you know, their lives are going to be sort of like much easier.
I think having this guideline is long overdue. I think it has galvanised a conversation. I think we need to make sure that it is well known and is used to make sure that we're putting homelessness on the map as one of the core priorities that we need to deal with to tackle health and well-being, and more importantly, health inequalities. We know that people that experience homelessness will access healthcare systems later on in their condition or healthcare needs, and will stay longer in acute care because of the exaggerated impact of the ill health that they're experiencing. So having this guidelines gives us an opportunity to really understand that and prevent that escalation of harm.